Yes, hi, Nick. I'm Geoff Warne and I'm the Chief Executive of the Leprosy Mission International.
What can we learn from the Millennium Development Goals about the use of drug therapy and in relation to leprosy?
Well, in relation to leprosy, there's probably not a great deal in the MDGs. Leprosy treatment was already highly effective way back from 1981, and what we've seen in the world is a dramatic reduction in the amount of leprosy ever since, until now when it's kind of stabilised, so we don't really know what the situation is. To us, the MDGs issue was, or the significant thing with the MDGs, was that leprosy is a very disabling disease, and there would be only about 250,000 new patients in a year, but perhaps 3 or 4 million people in the world that are disabled as a result of leprosy. So the fact that the initial MDGs did not include any reference to disability, and disability is a poverty-causing issue, that was a problem for us. And it's been encouraging to see the UN in thinking about what next after the MDG period is finished, is starting to focus on disability, which is terrific.
And I understand, do you have some thoughts about clinical trials?
Yes, clinical trials is interesting. There are currently no really serious candidate drugs for leprosy in the pipeline. We have 3 drugs that we use routinely and have done, as I said, since '81. And until now, the resistance to those 3 drugs is fairly low. So that hasn't been a big issue. What is a significant issue now is that it's been identified that a certain drug can be very valuable in a single shot for chemoprophylaxis purposes. So we are very interested, all leprosy agencies are very interested in the idea of connecting with the contacts of index cases with leprosy and trying to motivate them to allow or enable those contacts to take this single shot of rifampicin, which is the drug of choice. But that raises serious ethical issues, because leprosy is a very stigmatising disease. People don't want to admit they've got it, not even to themselves sometimes, and certainly not to family and friends and community. You can lose your family, you can lose your job, you can lose your contacts in the community. So the big ethical issue with clinical trials is how to enable the patient and their family to participate without having to disclose things that they don't want to disclose. And so we've got a situation, we've got a good proof of concept for the drug, but no clear way of being able to implement that on a broad scale. And we're doing some interesting work in different countries, the ILAB agencies in different countries, to see how that could be done in different sorts of communities, different sorts of cultures.
Brilliant. Okay, thanks very much.